Hey guys, so I just wanted to check in with you. I'm going to be rolling out all of the PowerPoint associated with this week, the updated version of our last lecture, which was on post-traumatic stress disorder. And then this week, we're going to start talking about the obsessive disorders and impulse control disorders. But before I do that, we're in an abnormal psych class, and these are pretty substantial times in the life of not just all Americans, but everyone worldwide with regards to mental health and mental illness. And I would be remiss if I didn't discuss or at least bring up some of the kind of myriad issues that are just starting to kind of germinate in individual lives, their home lives, or kind of broader issues as well. So what I wanted to do was I wanted to go over some possible questions that you or people that you know or people that you love might be kind of grappling with regards to what's going on right now. So I'm going to do a little switch here and bring up some questions that might be linked to what's going on with you right now. So I'm having a lot of anxiety because of the coronavirus. Please help. I'm quarantined or working from home. I'm lonely and isolated even further. What can I do? I don't have health insurance. What if I can't get my medication because I'm quarantined? My business, and this might be a big one, is suffering. What assistance programs are available? Are people who have mental illness at greater risk? Is there a vaccine? I lost a loved one to corona. Where can I find support? I'm a smoker. Am I more likely to catch it? How does homelessness increase the risk? My loved one is incarcerated. Are they at increased risk? I'm the aging parent of an adult child living with a serious mental illness. We can flip that around as well. So if you are an adult and if perhaps you have an aging parent, whether it be a serious mental illness, a medically complicated or complex situation, dementia, Alzheimer's, increase of individuals with substance use. Ironically, one of the things that is deemed essential, one of the stores that's deemed essential is, liquor stores. I'm wondering how many people who are left at home, left to their own devices, not having to drive anywhere and not having anything else going on might actually start to develop some substance use issues just based on the situation. So those are just some possible questions that might have been kind of bandied about in your minds or people that you know. So what I'm going to do is I'm going to post on Canvas the source for these questions, and that's the National Association or National Alliance of Mental Illness, or NAMI, which is kind of like one of the overarching bodies for individuals in psychology, psychiatry, social work, all that good stuff. And it's the COVID-19 resource and information guide. And it's really comprehensive. I'm not going to go through all of it. As I said, I'm going to post it. You guys can kind of look at it at your leisure, just for your own, it's helpful for the class, but obviously for your own personal research as well. And they have a lot of websites, a lot of numbers that you can reach out to. This hasn't been vetted. I haven't gone through to make sure that these are, obviously this is something that's new. This isn't a resource that's been around for more than, a month or two. So I'm assuming that all the links and all of the resources that they have listed are kind of active and available and currently able to kind of support people. So again, we're in an abnormal psychology class. It's, I think it's something that is beyond pertinent. And as we start to see when we're continuing on with our lectures this week, this pandemic is very likely going to have long-lasting effects, unfortunately, not just on the individuals who have the actual physical illness themselves, but the ramifications with regards to mental illness, whether people have underlying mental illnesses and this kind of exacerbates them, or people who are dealing with their own mental illnesses right now, switching. Most therapists are doing teletherapy, some are still doing in person, but this is huge. This is potentially a really big impact on mental illness and mental health and mental wellness. So just wanted to put this up there. Still working on everything for you guys. Hopefully everything is going okay. Everybody is hanging in there. Everybody's staying healthy mentally and physically, emotionally, spiritually, all that good stuff. Miss you. And I will be updating everything on Canvas. I'm going to try to get it done this weekend. Luckily, it's a pretty rainy, drizzly, miserable day. So stay inside, stay warm, stay dry, stay healthy. Take care, guys.